Dos.
Okay, now. Well, hello, this is Dr. Verduzco from Medical Spa. So I'm gonna just show you a little bit about a non-surgical treatment that is gonna be an overall face enhancement. So we're gonna improve the way she looks, the way she feels. And we're gonna start with something that is gonna be really interesting. We're gonna find out what's her emotions when she actually look at herself, just to make sure that we get what she wants mainly, and we can actually see what her concerns are and how to treat them. So I'm gonna show her right now in the mirror, so she's gonna let me know what she feels like. So, see, hello, Rosina.
Hi.
So we're gonna see probably the areas that you're more concerned of. Which one could be?
The chin, the under eye,
The lips.
and the lips.
Okay, so what about so what about the, like, how do you feel? Like, do you feel like tired? Do you feel probably like, yeah, you need to rest more? What do you feel?
I feel like my face looks like so tired.
So that's what one of the things that she wants to try. She wants to be more
my
tired.
under eye.
This time, and of course, more attractive, right? So how do you become more attractive when you're actually looking for? How do you become more attractive? Definitely, it's feminizing the face. So probably adding a little volume on her cheek could be a good way to do that, and treating the under eye to lift to the eye, treating the lips, and definitely the chin to take care of the double chin. So what we're gonna do right now is gonna take a picture. Straight. Just like that. Okay. So we're gonna take a picture right there. Side too, so we can actually enhance the nose too. Right, so right there. So I propose using this treatment to actually enhance the cheekbones, just to make it more triangle look. Just see it como está un color sol. So kind of make it more narrow, right, into a triangle look. We can actually enhance the under eye as well, and the lips too. We're gonna actually white them up a little bit. So we'd like to know exactly what you like. Right here, let's see. Would you like your lips to be filled on the sides or on the middle part? On the sides or in the middle?
Sides and middle.
Like, let's see, yeah, let's see both, like that. Yes? And what about the lower one? You like the lower one bigger or the top one bigger?
The lower one.
Like 50-50? Right, so we're gonna mark right here. So we're going in, right? So how do you like your lips? Do you like them to have the two little pillows on the bottom? Like this? Or leave them straight like that?
No.
With a little pillow? Right.
It's hard for me to talk.
Yes, because you had the numbing cream, right? Alright, so we're gonna start right now with the procedure. ¿Qué pasó? Dime rápido. No, se los pongo para el... So right now we're gonna start actually just showing you the syringes that you're gonna be using. So we're gonna be using the Juvederm Ultra Plus XC. I'm gonna be using the Radius too, which is Radius is the best for the face contouring. This is gonna last for a little bit longer, and it's also gonna stimulate your collagen. So this one is hyaluronic acid based. This one is hydropathic based. So it's two completely different fillers. This one lasts differently, longer. And this one lasts less. This one is based on water. This one is based on collagen. This one is, they're both FDA approved. They both wanna last, they're not permanent. They last 1 year and 1.5 years. So now we're just gonna start embracing. So we're gonna start doing the marking. So we're gonna go through the line. We're gonna actually mark down there a little bit where we're embracing. So we're gonna see cheekbones, so we want a high and triangle narrow. so we can actually look so much more feminized. So that's something I do pretty much every single day. So overall, in art, so you can be creative, you can decide what to do, you can actually look into actually improvement in certain areas and try to start looking, so making some cosmetic modifications on your face to improve the way people perceive you. So what would you think if a person comes out with a big eyes, a big smile, you're gonna see them friendly? What would happen if they come probably with small eyes? There's more focus, they're gonna see more, probably more interior, like more, probably less outgoing, so you cannot treat them better. So it's important to know that fillers could actually change your life in a certain way. So we're gonna start right now just by adding a little bit of volume. So we're gonna be using the radius. So he's my assistant. He's Memo. He's a nurse. He's a certified nurse. So he's gonna have one little one with some special cleaning equipment, which is chlorhexidine, and the one is gonna be dry. So he's gonna start cleaning. Limpia aquí un poquito. No, no, limpies las marcas. Vamos, haz a toque. ¿Lista? Derechita. Presiona. Sí. Presiona. So you're gonna have to feel the bone, and I'm going in the bone. No vessels will never go through the bone, so there is no vascular areas that will compromise when you do an injection with this kind of security. Look at the cheekbone. Look at the other side. Natural. Natural, lifted. So you see. Now we're gonna go work on the chin. So I'm gonna do with needle. I usually use a micro cannula, but I'm gonna do with needle. So I'm gonna go really close to the bone right here, directly into the bone. As you see, she's relaxed. She's barely feeling anything. The numbing action is always good. And I'm gonna go to the side. So under the muscle, so we create that beautiful pouchy look and look. Look at this narrow right here. So look, this one was this side, this one will be the other side, and it's gonna be specifically the same. That's the good thing when you have an injection with somebody that manages the codes. So you would always pinch exactly the same amount in each side and you specifically mark for it. So most of the people that has injection has to be marked. So marking is the main way that I can actually achieve the goals that I'm aiming for. So we're gonna do this side right here. So we're gonna go through the under eye, straight into the muscle. Why am I not concerned about vessels and nerves? It's because I go exactly on the bone area, which there is no vessels, where you can actually poke. So I'm going to touch exactly where the chin, I'm sorry, the bone is there, right? So what do you guys think? So look at the two syringes. Exactly the same, right? So pasa la otra. Vamos a poner una jeringa de los labios. ¿Puedo poner la masita? Un pinch. Priscilla, do you feel any pain?
Mm-mm.
Vente aquí. Aquí, aquí este lado, ahí.
¿Yo?
Sí, ella. Dice un poquito. You feel any pain?
Mm-mm.
Take a look in front. Take a look in front. Then open the front. I want to show you something really nice right here. So aim on the arch right here. Yeah. Just aim on the arch. Aquí, mira, ponlo aquí. Que se ve ahí. Ahí está. Look at the smile right here, and the other side. Just, mira. Ponlo así, derechito así.
No, está bien.
¿Me voy a girar? Aquí atrás. Ahí estás bien. Ahí estás bien. Sigue, 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 sigue. Ahí.
Hay que cerrar cuando hace la curvita.
Frío. Pues por acá, está aquí, enfócala a ella. Ok, enfócala a mí, ¿sabes hacia atrás? Voy a poner un poquito en la cabeza. Ponte el ladito, vete que le vas allá. Voy a subir su manita así. Ok, este piquito va a doler un poco. Enseña la nariz aquí de lado, ponte de lado, de lado, de lado. Okay, take a look. Mira, vamos a verte. ¿Qué opinas?
Súper diferencia, ¿no?
Muy bonito.
¿Verdad?
Sí. El labio de arriba me encanta cómo se ve.
La sonrisa.
La sonrisa, ¿verdad?
Este de aquí, ¿verdad?
De esquinita, ajá.
Sí, me encantó.
Música.
Ponte aquí. Ok, quiero que veas un poquito lo que te hicimos. Ok. Mira. Quiero que veas aquí. Quiero que veas cómo se mira esto. Redondo. So how does this look? This completely round, right? In an oval look. How does this look in a triangle shape? I want to see the difference on the under eye. Huge improvement. How is more triangle is more attractive. I want to show you right here what's different in your lips. Look at the corner right here. There's the kiddo smile. They're both lifted, but both nice. How it looks more like the pillow that you recommended, which it looks like the keyhole, right? So that's actually a really nice look on your lips. How the top lip is flip already, and look how the jaw defines differently, but you can work on the chin. How this is square, this is more triangle. So remember, always in women, triangles are the ones that you want to get. This is your under eye. Vamos a girar. Vamos a ver a mí. So girls, this is 15 minutes face enhancement. So it's all done through injections. They're all legal injections. They're all cosmetic injections, FDA approved, and also they're all just 1 month, 1 year to 1.5 years lasting. So they're all not permanent. So these procedures could be done. They're safe. They're good. Completely recommended. So we use 2 syringes of radius. We use 1 syringe of Juvederm Ultra Plus, and that's the immediate results. So a lot of options, but not a lot of good results like this in the same matter. Thank you so much. This is Dr. Sergio Verduzco from Tijuana. So I hope you to come here and meet us beautiful spa. Thank you so much, and we'll see you next.